After a stroke or a brain injury, the most difficult abilities to recover are the ones of the hand. Controlling the hands requires a large amount of brain resources because of their large number of degrees of freedom and their high sensitivity, resulting in their surprising dexterity. This complexity needs to be matched by comparably sophisticated rehabilitation devices. During the project, we developed a new powerful exoskeleton for hand rehabilitation. The utilization of the assist-as-needed paradigm is a significant step forward in hand rehabilitation. By replicating proprioceptive stimuli through interaction with a virtual reality environment and serious games, the exoskeleton can provide tailored assistance to patients based on their specific needs. This personalized approach can lead to more effective rehabilitation outcomes. The emphasis on freedom of movement at the wrist is crucial for restoring dexterity and range of motion in hand rehabilitation. By minimizing the burden on the user's limb through remote actuation, the exoskeleton allows patients to perform natural movements without excessive resistance or restriction. The modularity of the device and the ability to swap parts worn by patients is a valuable feature. Rehabilitation often involves patients with different anthropometric measurements, and the ability to accommodate a wide range of individuals is important for ensuring the exoskeleton's effectiveness and usability. The implementation of a single degree of freedom for each finger, controlled by a remote actuator, is a design choice which enables targeted rehabilitation exercises for specific finger movements while maintaining simplicity and ease of use. Additionally, the inclusion of a passive degree of freedom with an ad hoc thimble on the distal phalanx adds versatility to the exoskeleton. This passive DOF can potentially facilitate more natural grasping and manipulation actions during the rehabilitation process.
An innovative aspect of HES is the ability to use the thumb in a fluid way. The ability to oppose the thumb in a natural way means being able to perform different grasps. It is very difficult to mimic this ability with a robotic mechanism. Compared to other products, this one allows us to make the opposition movements, so the thumb can touch all the other fingertips. Therefore, this implementation of the thumb mechanism seems innovative. In other systems, this finger is often used only in flexion extension, while in this case it is also possible to make abduction with a proper opposability of the thumb. Moreover, I really liked the fact that the wrist joint is not rigid, because the flexion extension of the wrist is important in reaching movements. If you want to reach for an object, for example a bottle of water, there are anticipatory strategies propedeutic to the arrival at the target. First the shoulder flexion, then elbow and wrist extension are needed to be able to reach an object and finally close the hand to bring it back to you. Compared to other prototypes which I've tried, this one is soft and more comfortable and allows us to flex and extend our wrist. Another aspect that I appreciated is the fact HES is fastened to the intermediate phalange, leaving the fingertip free. This preserves the patient's fingertip sensitivity. Many exoskeletons don't have this feature, and the fingertip is covered, which hinders the quality of the grip. Compared to Amadio by Tiramotion, there is a problem related to the weight of the exoskeleton. Even though HES is still a prototype, this critical problem has to be fixed. The researchers will surely find a way to support the forearm and the transmission Bowden cables without impeding the pronosupination movement of the forearm.
Per poter consentire il reaching, comunque il gomito deve potersi muovere in flessa estensione e poter fare un movimento di pronosupinazione.